Plenty of research suggesting that a person's diet can affect the risk of cancer, particularly gastrointestinal cancers. And that's why during this National Nutrition Cancer Month, Dr. Scot Ackerman, an oncologist, radiation oncologist, and the chief medical director at Ackerman Cancer Center is here to talk about the critical role nutrition plays in cancer prevention. Good morning. Thanks for being here.
Thank you, Bruce.
So this is really all about making good lifestyle choices.
Absolutely. We've eliminated a lot of the toxins in the environment over the years to reduce our risk for cancers. So years ago, we had environmental toxins and workplace, occupational toxins, and smoking has been reduced quite a bit. And we've gotten to a certain point now where we're looking at what's left that we can influence to reduce our risk of cancer. And diet and exercise now is hugely important in relationship to cancers.
So maintain a well-balanced diet, a healthy weight, refrain from smoking, staying active.
Exactly.
They're
all
the
those
keys.
things. All those things. So a well-balanced diet, meaning having a diet high in fruits and vegetables. I talk about the colors of the rainbow. I talk about maintaining a healthy weight, so getting good exercise. Exercise 3 or 4 times a week for about a half hour, 40 minutes a day is enough to do that. To avoid, as you said, smoking. Alcohol has been related to certain cancers. Alcohol, to minimize your alcohol intake. For men, we recommend no more than 2 drinks a day. For women, 1 drink a day. Diet, as I mentioned before, fruits and vegetables, high fiber diet, diets that don't have a lot of added salts and sugars, those sort of things.
Let's talk about the foods we should be adding to our diet. Foods that are high in antioxidants, right?
Right, and these include green leafy vegetables, colorful fruits, beans, those sort of things.
So the fiber-rich foods.
Exactly. Well, fiber also. So not just antioxidants, but also fiber-rich, because those are 2 separate things, and they do different things. So the antioxidants reduce your overall risk of cancer. High fiber foods are good for gut health, your gastrointestinal tract, colon cancer, stomach cancer. So the high fiber foods move all the toxins out of your colon more efficiently and reduce your risk of colon cancer.
And the foods to avoid, they're usually a lot of the things that are quick and easy to grab.
Well, the foods to avoid, these snack foods, these processed foods, foods with added sugar, foods with added salt, foods that have high fructose corn syrup in it, those things all give you increased obesity, have lower fiber, so foods that, as I said before, don't move through the GI tract very well, so those are the ones to avoid.
Yeah, when you talk about highly processed foods, a lot of times the things you get at the deli counter and stuff are highly processed and have all that extra salt and things that aren't good for your body. And that doesn't mean that you can't occasionally have something. It just means, watch what you eat.
Oh, absolutely. I enjoy a good salami sandwich,
Yeah.
but in moderation.
Right.
So those processed deli foods have nitrates in them and things like that. They're also very low in fiber, so we want to minimize that. But you want to have some meat in your diet. You want to have low protein, you want to have lean protein, lean meats, or fish is also a lean protein. Those are good to have.
Now, you talked about alcohol. You can limit alcohol, but eliminate tobacco products.
Right, eliminate tobacco products. Tobacco is associated with 20% of all cancers, and that's a lot. And we've really reduced tobacco consumption in the United States at this point. It's hard to get it much lower than it is now, but eliminate tobacco products. And alcohol, we want to minimize that. Alcohol isn't all bad. Alcohol is good for heart disease, red wine, absolutely. But alcohol in excess leads to certain cancers. For instance, in women, we've seen more than 2 drinks a day increasing a woman's risk for breast cancer. In men, we say no more than 2 drinks a day for men as well.
So lifestyle, we've learned, doctors have learned, research shows, plays a big role in preventing cancers. People go, I work so much, I don't have time to go to the gym, I don't have time to exercise. Exercise doesn't have to be lifting weights, going on the treadmill. I mean, taking a nice walk or taking the stairs, at work or whatever, that constitutes exercise.
It's generally 100, 130 minutes a week. So if you think about that, if you're exercising 45 minutes, just moderate exercise, 45 minutes, 3 times a week, you're already at 135 minutes a week.
Right.
So half hour a day, 3 days for 45 minutes a day, that sort of thing, but just moderate. As you said, not lifting weights, but taking the stairs, walking, walking around the block, those sort of things.
Walking the pets with your significant other, walking with the kids. Those things that you don't think are exercise, they really are.
Absolutely. They're exercise physically and mentally when they're with your spouse or with your kids.
And that's another thing that's important. Your emotional outlook has a great deal to do with your physical health.
And getting good sleep and having a good state of mind, reducing stress in your life. All those things as well reduce your risk of cancers.